Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Endometrioma or chocolate cyst. The most common site of endometriosis is in the ovary in 30 to 40% of cases. Endometrioma is bilateral involvement of ovary. Here in endometrioma, ovary is filled with blood. So hemosiderin in endometrioma, ovary is filled with blood. So the blood gets converted to bilirubin and thus there is hemosiderin deposition in the chocolatey or tarry blood giving rise to chocolate cyst. The cyst is lined by pseudoxanthoma cells. The cyst size is less than or equal to 12 centimeters. Management of endometrioma. Endometrioma cannot be managed medically. It can be managed by surgery. We do laparoscopic surgery. If laparoscopic surgery is done, if the lesion is less than 3 centimeters, we do laparoscopic electrocoagulation. If the lesion is more than or equal to 3 centimeters, then we do laparoscopic cystectomy. The sites where endometriosis cannot be managed medically include ovary, bowel, and urinary system. Sites of endometriosis which cannot be managed medically are ovary, urinary system, and the bowel.
thank you and thank you for watching.